Hi, everyone, and welcome to 2019. This is the first installment in our 2019 series of webinars offered by the North Central Region Aging Network. And I am Dr. Erin Yelland. I'm an assistant professor and extension specialist at Kansas State University, and I'm currently the co-chair of the North Central Region Aging Network. The North Central Region Aging Network is a collective of gerontologists and aging-related extension professionals from across the North Central region. And we are dedicated to providing resources, tools, and professional development for all kinds of extension professionals across the country. As part of that, we offer a twice-monthly webinar series, which you're listening to one of those today. On the first Friday of the month, we offer our Gerontology 101 series. And this is where we cover all sorts of topics, programs, and curricula related to aging. And then on the third Friday of the month, we offer our Professional Development series. And this is a series that is really intended for use by all extension professionals, regardless of your area of focus. Things that we will talk about in our Professional Development series are reaching new audiences and working with diverse audiences, understanding how to communicate your elevator pitch, and even things like evaluation. So we hope that you join us for our webinar series, again offered on the first and third Fridays of each month. Many of our webinars are presented live, but some of them, like this one, are pre-recorded. But regardless of whether it's pre-recorded or offered live, you can always access our webinars on our website at ncran.org/learn. You can also find all of the materials, resources, and curricula that we discuss in our webinars on our website as well. So I encourage you to check out ncran.org. Today, we're going to be talking about keys to embracing aging. And this is a program that I helped to develop when I was a graduate student at the University of Kentucky and was ultimately developed out of the University of Kentucky, University of Arkansas, and Kansas State University. This is a program that's very near and dear to my heart and is something that we have worked really tremendously hard on for several years. And we have been able to build it to a program that is really ready for you to use, take and use with all sorts of audiences and help to improve people's lives. You may have heard about this program as we have presented it at several conferences, whether that's NEAFCS. We've also presented it at the American Public Health Association conference, the National Council on Family Relations, and several other state and regional conferences as well. So if you think you've heard about it before, you might have. But if you haven't, this is going to be an introductory little piece to the program and how you can implement it in your county or in your counties. So first off, where did the basis for the Keys to Embracing Aging program come? It is based solely on the Blue Zones, really. So the Blue Zones are a collection of locations across the world where people live disproportionately longer than people who live in other areas of the world. There are 5 blue zones across the world, one of which is in Loma Linda, California, where we have a diverse sect of Seventh-day Adventists that practice very strict and healthy lifestyle behaviors. Next is in the Nicoya Peninsula of Costa Rica, Sardinia, Italy, Icaria, Greece, and Okinawa, Japan. So those are the 5 blue zone areas across the world. And you may have heard of the author Dan Buettner, and he is a researcher and scholar who is really focused on these blue zones and has done a lot of research in the areas and has published numerous books and has done numerous talks as well on the blue zones. And you can see the title of his first book here is The Blue Zones, Lessons for Living Longer from People Who Have Lived the Longest. And the research from the Blue Zones tells us just that. In addition to the Blue Zones literature, much of the Keys to Embracing Aging program is focused on the medical literature and research that has been done on longevity or one's ability to live a longer period of life, as well as literature and research on healthy living, healthy aging, and all of those good sorts of health and wellness across the lifespan topics that we oftentimes hear about. So that is really the basis of where this program came. So Dan Buettner has been out doing this research on the blue zones, and in Extension we said, okay, so how can we take the research and the work that has been done on the blue zones, on health and wellness across the lifespan and longevity, and translate it back into a curriculum that can be easily picked up by Extension professionals across the United States and implement it in their communities to help improve overall health and wellness. And this program does just that. So, keys to embracing aging. You might be wondering, what are the keys? Well, here they are. We have 12 keys to embracing aging, which, as I mentioned before, are based on research and evidence from the blue zones, the medical literature, as well as health and wellness across the lifespan, and some current extension practices as well. The first key that we cover in the program is positive attitude. And this is really integral because it sets the foundation for the overall program. It is very difficult, the research shows, to improve different areas of your life if you don't start off with a positive attitude. So this program is designed to start with this key of positive attitude that'll sort of set the basis for the rest of the program as it comes along. Next up, we have 2 keys to embracing aging that will not surprise anyone. The first is eating smart and healthy, followed by physical activity. And in all of these keys, we talk about the basic concepts of each key, and we also challenge people to improve their own behavior in each one of these key domains of overall health and wellness. So, in eating smart and healthy, we talk all about the MyPlate guidelines, how to make simple changes that can make a big difference in your diet. And we also challenge people to track their water consumption, maybe track how much sugar they're eating if they identify that as a concern for them. The point is that we want people to identify a concern that they have in their life, maybe to learn about something that they should be improving in their life, and make a commitment to improve that. So whether it's drinking more water and less sugary drinks, maybe it's increasing protein and lean meats rather than our carbohydrates, or maybe even swapping out refined grains for more whole grains. Finding that unique challenge for you or for your participants and then challenging them to improve that behavior is really one of the goals of the program. Next, we get into physical activity. So here we go through the physical activity guidelines and recommendations and talk about ways that we can incorporate healthy physical activity into our lives. And one of the things that I love talking about with participants in this section is that physical activity doesn't mean that you have to go out and run 3 miles a day or flip tires and climb ropes like folks do in CrossFit. But if that works for you, that's absolutely wonderful. But if you more so enjoy walking, gardening, playing with your grandkids, getting out and about, those can count as forms of physical activity as well. The next key is brain activity. And this is a very popular one because it seems like everyone these days is worried about Alzheimer's disease. So here we get into steps that individuals can take to improve their overall brain health across their lifespan. Now we know that Alzheimer's disease cannot officially be prevented. We don't know what causes it, and we don't know the cure or what can prevent it. But we can say that engaging in healthy brain activity can help to delay the onset of cognitive decline in your later years. So in this portion of the Keys to Embracing Aging program, we talk about just that. Next is social activity. And in this key, we talk about the importance of meaningful relationships. And meaningful relationships can look different for everyone, but it's important that we harness those meaningful relationships and engage in those meaningful relationships across our entire lifespan. We know, especially among older adults, that isolation, depression, loneliness are quite common, and that is incredibly detrimental to one's overall physical and mental health and wellness. So we talk about social activity, the importance of it, and the benefits that can be achieved from social activity, and go into some ideas for incorporating more social activity into your life that makes you comfortable. Next is tuning into the times. And the research from the Blue Zone show that folks that are who are actively engaged in their communities, are more aware of current events and what's going on around them, are more likely to live longer and healthier lives. So in this key, we talk about just that, tuning into the times, whether that's embracing technology, staying up to date with the news and what's going on around you, or even engaging in the latest dance craze with your grandchildren or children. We talk about all sorts of things that we can do to stay in tune with the times and also the benefits of doing so. The next key is safety. And in this session, we talk all about safety of all sorts. So whether that's recreational safety, such as wearing your bicycle helmet, or even just general home safety, such as using correct smoke detectors and carbon monoxide detectors, maybe even utilizing smoke detectors that have a strobe light for those individuals who are hard of hearing. In this section, we talk about all sorts of safety ideas and tips and tricks for improving safety in your life. If you're working for an older adult audience, this is a great time to talk about fall prevention as well. The next key is know your health numbers. I always start off this key by talking with folks about how often they attend their regular physician's visits, and their doctors will tell them that, oh, everything looks great. All of your numbers were great, your blood work came back great. Well, how many times do we ask our physician, well, what was my total cholesterol? Having this understanding and knowledge about your own health can greatly improve your own awareness of your health, but also understand how these minor fluctuations in your health, your diet, your well-being can impact your overall health as well, including those health numbers. So we talk about what is cholesterol and where are we supposed to be with that. What's HDL versus LDL, triglycerides, even your blood sugar and blood pressure numbers, and your waist circumference, which many people say can be a huge sort of determinant of your overall health. So in this section, we talk about those health numbers, what they mean, and how we can improve them. But really, we want folks to understand that it's important to know those health numbers, because even within normal ranges, we can still have a wide variety of fluctuation. So how can we keep track of those numbers and understand when we're making small improvements or even when we've had a small setback in our health numbers? Next up is stress management. Stress management is all about managing the stresses of daily life and understanding that not all stress is bad stress, but when we do have bad stress, how we can manage it in an appropriate way so that it becomes more of a good stressor. Stress is actually very important for your body and is something that we deal with throughout our entire lifespan. So understanding ways that we can manage our own stress more healthfully, understanding our stress triggers is a big part of overall health and wellness, and we talk about just that in the stress management section. Next up is financial affairs. Now, as you can tell from our description of all of the other keys, we don't go into a whole lot of depth and detail into each one, but rather we talk about the major issues around each key and steps that we can take to improve our own health and wellness. And a part of our health and wellness is financial health and wellness. So in this section, it is really up to you to determine what types of information your audience might need, whether they may need information on overall budget development and being able to follow that budget, if they need information on wise use of credit, or even avoiding reverse mortgage scams that tend to be common among older adults. You can take whatever information you feel like your audience needs and transform it into a module or a presentation that is useful for them. So in financial affairs, we offer a whole host of information that you can take and give to your particular audience. The next key is sleep, and this is all about the health and wellness benefits of sleep, but also how to incorporate more restful sleep into your daily life. And lastly is taking time for you. So you'll see that we start off the Keys to Embracing Aging program with positive attitude, because that lays a proper foundation for improving your life in all areas and facets. Then we end with taking time for you. And this is strategic as well, because first of all, you need to have that positive attitude, but at the end, you need to realize that it is so important to take time for yourself, whether that is taking time to read a book or do something that helps to relax you or something that you enjoy, or if it's taking time for yourself to prepare healthy meals or engage in physical activity and exercise, or if it's taking time for you to sit down and figure out where you are financially and how you can improve your future financial outlook. You'll see that placing this at the end of the keys is incredibly important and can be very valuable to individuals' progression within the program. So that's an overview of the Keys to Embracing Aging. And next I want to go into some of the basics of the program so that you understand where it's come from, how it aligns with current practices, and how you can use it in your local community. The Keys to Embracing Aging program is research and evidence-based. So you heard me mention at the beginning of this brief webinar about the research that's been done with the blue zones. But this program has also been tested with a variety of audiences, and we have a large stream of evidence showing that this program can be effective with audiences of all ages, professions, and group dynamics as well. And I'll get into some of that evidence in a little bit. Next, we want you to be aware that the Keys to Embracing Aging program aligns directly with national trends, as well as the Cooperative Extension's National Framework for Health and Wellness. So this program fits directly within the scope and mission of Cooperative Extension, as well as USDA NIFA and the Adult Development and Aging Work Group. Finally, this is a fully scripted curriculum with everything that you will need for free. And I will go to our website and show you where you can access the curriculum and all of the resources, worksheets, and tools that come along with it. Next up, the program is flexible and adaptable. So currently this program is being delivered in numerous states across the United States. And we're so proud of that. Again, it was piloted and originally debuted in Kansas, Arkansas, and Kentucky. And since then, we have expanded to other states as well. It is so easy for extension professionals to pick up this program and begin delivering it in their local community. Keys to Embracing Aging is also a great lead-in for other programming and initiatives. So if you would like to start a brain health initiative with a community council in your community, starting off with the brain health module in this program would be an excellent idea. Or if you want to get together with a local area agency on aging or other nonprofit agency or agency that's doing work on health and wellness in your community, you can use any of these keys to help bolster your programming, use it as an introductory piece, or even as a capstone piece to any sort of initiative that you're doing in your local community. Finally, this program is life-changing, and our research from implementing the program shows just that. and the evidence very much supports that. And we'll get into that after this next slide. So some more of the basics. Again, I have already mentioned that this program is flexible and is adaptable to all sorts of audiences, but I just want to give you a little insight into how it can be delivered. USDA NIFA recently funded Kansas State University and the University of Kentucky to implement the Keys to Embracing Aging program in 42 rural counties across both states. And in that sort of delivery, we developed and implemented year-long cohorts that went through the Keys to Embracing Aging program. So, for example, in a particular county, they would have approximately 10 participants that stayed together across an entire year and attended one program a month and completed a 30-day behavior challenge in between attending each session at the extension office or local library or wherever the program was held. This was proven to be an incredibly effective method of improving health and wellness behaviors among all cohort participants. And one of the favorite things about participating in a cohort was that they were with individuals in their community. They developed bonds with these individuals and made friends, but they also had people there to keep them accountable and report back on the progress of their 30-day challenges. So if you're thinking about doing some sort of repeated series event, the Keys to Embracing Aging program is an excellent idea. Now, you don't always have to perform it in the year-long extravaganza. Instead, you could provide one program a week for 12 weeks, or even combine some programs and do two programs, or do a single session program that covers multiple keys for a variety, for a series of weeks, or that sort of idea. So you can really take the 12 keys and divvy them up however you'd like and implement that education in your community in whatever way works best for you. We have also had individuals or extension professionals rather in several states who have presented aspects of the Keys to Embracing Aging program in a series. So for example, we had a New Year, New You series that was developed and which utilized the Keys to Embracing Aging program, and they utilized 4 or 5 different keys in this New Year, New You program that they were delivering at their local library. And it included the keys such as physical activity, nutrition, brain health, taking time for you, and I believe financial management as well. So they took different aspects of the program and incorporated it into a series that they knew that their community members wanted and that they would benefit from. You can also use the Keys to Embracing Aging program as a one-time program, and that can be done in 2 ways. The first way is that you can present the entire program, briefly cover all 12 keys in a single session, and that can be done anywhere from 30 to 60 to 90 minutes, really depending on the amount of time that you have and the amount of depth that you would want to go into on each key. You can also present each key as a one-time program. So for example, if you've been requested to do a program on brain health, you can take the brain health key from the Keys to Embracing Aging program and deliver that as a single-time program in your community as well. So there's a whole option or a whole menu of options for presenting this program. And in that, we have found extension professionals to be incredibly appreciative of the program's flexibility and adaptability for their use. There's also flexibility in audiences, meaning that although this program is titled Keys to Embracing Aging, this is not a program intended only for older adults. This can really be used with people of all ages, ranging from your 4-H youth to high school audiences who want to learn more about health and wellness across the lifespan. You can even use this with young adults or young adult professionals middle-aged adults as well, who want information not only for themselves, but their children, and perhaps even their aging parents. So you can really target this as a sandwich generation program as well. Any type of audience is really meant to hear this type of information, because it is all about health and wellness across the lifespan that will promote optimal aging. Lastly, I want you to be aware that the Keys to Embracing Aging program is interactive and it's engaging. So with each key, we have, of course, a scripted PowerPoint that you can use for general education delivery, but we also have scripted and ideas of worksheets, interactive activities and engaging activities that you can do with your audiences, as well as 30-day behavior challenges that you can encourage your audiences to engage in, and then track as well to see how people are improving their overall lifestyle behaviors. So we have different activities that you can do. We have scripted exercises that you can do with a whole variety of audiences. We have a scripted Neurobics Olympics, and Neurobics is a fancy word for doing brain exercises, and we have a Neurobics Olympics that incorporates different activities that you can do and engage folks in, so that they're doing all sorts of activities that work their brain in different ways. We have a whole host of activities, worksheets, and good things that go along with every single key. So no matter what the topic, there's something interactive and engaging that supports the education that's going to be going along with it. So what have we heard? Here are a couple of quotes that were provided by Extension professionals, and the first of which says that one of the participants shared with me that she had had depression in the past and she didn't leave her house for a year. But when she started attending programs offered by the Extension office, it really started helping her to get out of her depression. And this was specifically from the Keys to Embracing Aging year-long program that a participant decided to enroll in, and it really changed her life. And this was an email that we had received from one of the Extension agents. And this participant had pulled the Extension agent aside and told her, you know, this really personal part of her life and how she was struggling so much. But this Keys to Embracing Aging challenge really gave her something to work for and to live for and to help her get out of the house and improve her overall health and well-being, including her mental health. Next, an Extension professional said that participants are opening up about aging and have become a unified group as we walk through the material together. And again, this was feedback from an Extension professional who was engaging in that year-long cohort program from Keys to Embracing Aging. But you can see from these two quotes alone that Extension professionals have had great success with utilizing this cohort perspective or this cohort mechanism of implementing the program, and it has been effective for them. Some of the participant feedback. So far, we have had 100% of participants report that the program increased their knowledge related to health and well-being. So as you know, in Extension, we're always striving to improve knowledge, attitudes, and behaviors. And we are achieving that goal of improving knowledge about health and wellness across the lifespan through this program. 90% of participants were still using the resources from the Keys to Embracing Aging program 3 months post-program completion. So we find that people who attend this program continue to use the resources and what they've learned even after the program has ended. Finally, 77% of participants in the Keys to Embracing Aging program have made a lifestyle change and sustained it. So the percentage of individuals who made a lifestyle change immediately after the program or 30 days after the program was quite high. But we have continued to find that 77% of those participants sustained that change in their lifestyle 3 months post-program completion. And right now, we are currently completing the 6-month post-program completion evaluation. So we're excited to see the sustained activity that our participants have reported 6 months after attending the program. But at 3 months post, 77% of them had made a change and had continued to sustain it. The areas in which they have especially made a change and continued to sustain it are in physical activity, nutrition, social activity, stress management, and taking time for yourself. So those we have found to be our heavy hitters in regards to which keys are making the most impact. Finally, one of our participants said that I enjoyed learning the holistic approach to improving my overall health, especially helping my wife improve her and my diet to lose weight. She's down 30 pounds. This was feedback from a participant at 3 months post-program completion. And these two individuals participated in the program and made drastic changes to their overall lifestyle. And they embraced the 30-day challenge opportunity and incorporated that in their life. And by doing so, his wife, this participant's wife, made such dramatic changes in her life that she lost 30 pounds. And he later reported that they were engaging in so much physical activity. They had improved their overall social health. They were getting out more and spending more time with friends and family. They had even gone to a lawyer to talk about their finances and completing their wills. So they really embraced each aspect of the Keys to Embracing Aging program and incorporated it into their life and made huge lifestyle changes. So this was a particularly wonderful success story that we saw come out of Kansas with the Keys to Embracing Aging program. But although I've given you just a couple of quotes that we have received back from extension professionals and participants, we have a whole variety of success stories from this program that are very similar to this. But these are a couple of quotes that spoke directly to me, and I hope will give evidence of how this program has been used and how it has been perceived to be, how it has been perceived and proven to be effective across many states. So I hope that you have learned a bit about the Keys to Embracing Aging program. And next, I would like to take you to our website for K-State, and I will share a different screen with you here. Just 1 second. Okay. So here is the Keys to Embracing Aging information on the Kansas State website. So if you go to aging.ksu.edu, you will have access to all of the aging-related curricula that we have developed through K-State Research and Extension. And you can see over here on the left-hand toolbar, some of those programs include advanced healthcare planning, and this is specific to Kansas. So you can take the information presented in that program and apply your own state statutes to it. Alzheimer's 101, elder abuse, Gray for a Day, Keys to Embracing Aging. We have some information on PSE, or Policy Systems and Environmental Change, Powerful Tools for Caregivers, Simple Home Modification, Tips for Managing Retirement, as well as the opioid crisis. But today we're going to be talking about Keys to Embracing Aging. Now, I have to apologize because normally there is a great YouTube video that is posted right here. And I have checked the back end of my website and it's there and looks great. But then when I go to the website itself, we have a giant white box. So I'm hoping that we can get that fixed. but there is a YouTube video that goes along with this program that can be shared on social media, on Facebook or Twitter, or on your website, and it is meant for community members to view. So it goes through the 12 keys to embracing aging and challenges folks to improve their overall health and wellness. And that is available on YouTube, so you should be able to search for it and find it. Here are the key program materials. So you will find everything is scripted and ready for you to use and take. So first is a leader's guide, and this is a PDF of a document that walks you through the entire program, how it was developed, how it's evaluated, and the different ways that you can present it, different audiences, et cetera, et cetera. So all the information that you will need about the program is located here in the leader's guide. Next, you will see a series of PowerPoints. So we have 13 different PowerPoints that support this program. The first of which is Keys to Embracing Aging 101. And that PowerPoint introduces all 12 of the keys to embracing aging in a single sitting. So if you want to do a one-time program that introduces the Keys to Embracing Aging program, this would be the PowerPoint that you would like to use, or that you should use. Next, we have PowerPoints supporting each of the 12 keys to embracing aging. So as opposed to this overall PowerPoint, these go into a great deal of depth of information, as well as has more activities and challenges that you can do with your participants. Next, you'll see our series of fact sheet publications. So here you'll have the fact sheet for Keys to Embracing Aging 101, which again introduces all 12 keys to embracing aging in a very brief format. Then you will see that we have very in-depth fact sheet publications on each of the 12 keys to embracing aging. Next, you will see our evaluations. So we are still evaluating the program. First, you will find the 101 evaluation. So if you were to present the entire Keys to Embracing Aging program in a single sitting, this is the evaluation you would use. Next, we have a document with all of the individual key evaluations. So for example, if you only present the brain health key to your audience, there is an evaluation specifically for brain health. If you were to present a series, such as if you did brain health, physical activity, and nutrition in one sitting, you could print off all 3 of the evaluations and give those to your participants. Next, you will see program support materials, and this includes things such as a news release and consumer tips. So we have a scripted news release or radio spot template for each of the 12 keys, as well as for the overall program. We have a marketing flyer that you can use to advertise the program to your audiences. We have a success story template that you can use to help demonstrate the impact of the program to your key stakeholders. And we also have a 3-panel poster, and this is a display type of poster that introduces all 12 keys to embracing aging and is very good for use at health fairs or for presenting at your public library or the health department and other places as well. You will also see that we have a variety of worksheets, and all of these worksheets are detailed in the leader's guide and in the PowerPoint scripts for when you can use these worksheets and how to use them. So we have one on calculating your BMI. We have one on your bucket list, building your savings, eating smart with the My Plate, a family emergency plan, ready on a budget. We have recipe cards for a new and healthy you, stress management worksheet, and what are you doing to prepare? So here are a variety of worksheets that can be used with specific keys in the Keys to Embracing Aging program. Next up, you'll see our activity guides. So you remember earlier that I mentioned Neurobics Olympics. So this details exactly what we did with the Neurobics Olympics Gives you all the materials that you'll need to implement an aerobics Olympics and tells you exactly how to do it. We also have some desker size activity guides that are brought to you from the University of Arkansas. One on sit, stretch, and strengthen, and then one on small joints are a big deal. And these are activities that you can do with your audiences to talk about physical activity in a different way. So now I'm going to go back to my PowerPoint, but I just wanted to remind you that you can find all of this information at aging.ksu.edu. Lastly, that's all the information I have for you on the Keys to Embracing Aging program, but I did want to direct your attention to a survey of this webinar. So we want to evaluate all of the webinar offerings that the North Central Region Aging Network provides, and you can leave your feedback at tinyurl.com/NCRAN survey. Again, I am Dr. Erin Yelland from Kansas State University and K-State Research and Extension. And if you have any questions about the Keys to Embracing Aging program, I encourage you to contact me. My email address is erinyelland@ksu.edu, and you can reach me there anytime. We appreciate you joining in to the North Central Region Aging Network webinar series. And again, I remind you to join us on the first and third Fridays of each month, and be sure to check out all of the resources and offerings we have at ncran.org. Have a great 2019.